Hello, my name is Dr. Nadia Hansel. I am a researcher at the Johns Hopkins School of Medicine, and I'm here to tell you about a research study.
Hi, Dr. Hansel.
This study is for people who have COPD, chronic bronchitis, or emphysema, and who do not smoke anymore. Would you like to hear more?
Sure.
Great. Our goal is to learn whether using air cleaners at home will improve breathing, lung health, and quality of life for people with COPD who do not smoke anymore.
So you want to find out if people who have COPD and don't smoke anymore will breathe better by using air cleaners at home.
That's right.
How long will the study last?
If you join this study, you will be in the study for 9 months. Some of the information that we collect for this study and the biological samples like blood, saliva, and urine may be kept longer and used in future research, but these would be kept and stored without your name or other basic identifiers on them.
Do I have to be in the study?
No, it is up to you to decide if you want to join this study. If you do not join, your care at Johns Hopkins will not be affected. You can choose to stop at any time with no consequences. If you choose to stop, please tell us right away.
Okay, so it's up to me to decide whether or not I want to join.
Correct. It's up to you. We do not know if your health will improve from being in this study. We hope this research will help patients in the future.
I see. Can you maybe tell me more about the study?
Sure. If you join the study, there will be 6 parts. Some of these will take place at our clinic, and some of them will take place at your home.
Okay, it sounds like there's some things I will need to do at home, and for others I will need to come to your clinic. Can you tell me more about those?
First, you will complete a screening assessment. We do that to see if you can join the study. If we find that you can join, you will use air cleaners in your home, do 6 clinic visits, and we'll do 5 home visits. The air filters we give you for the study may or may not have filters installed. There also are monthly telephone calls. We ask you to keep a diary at home, and there is an optional overnight sleep study.
Okay, it would be helpful to hear a bit more about these activities.
Sure. Let's begin with the screening assessment. This will last up to 2 hours and will help us see if you can take part in the study.
How will you decide if I can join?
We will give you breathing tests to make sure that you do not smoke and to measure your breathing. For the breathing test, you wear a clip on your nose and blow out air. You will do this test, and then we will give you medicine in an inhaler, and you will do the test again.
Okay.
We will also do clinical exams to measure your weight, height, blood pressure, pulse, and breathing rate. We'll do a skin fold assessment, also known as pinch test, to measure body fat. You will complete questionnaires about lung disease, shortness of breath, family history, medical conditions, and any medications you are taking. We will also do a home air quality screening, which will involve putting a device in your home to measure air pollution over a 1-week period. Only some homes have the kind of air quality needed for this study.
So what happens if you decide I can be in the study?
If you are eligible for the study, we will give you 2 air cleaners.
What will I do with the air cleaners?
1 air cleaner will go in your bedroom. The other air cleaner will be for a room where you spend the most time.
Will the air cleaner machines need to be turned on all the time?
Yes, they should run all of the time.
You mentioned that they will be using air cleaners that may or may not have filters in them. Can you tell me more about that?
Absolutely. Half of the people in this study will get air cleaners with filters installed. They will be in Group 1. The other half, Group 2, will get air cleaners without filters. You will be randomly assigned, by chance, like drawing names from a hat, into one of the 2 groups. So, your air cleaner might have a filter and it might not. You will not know which group you are in. At the end of the study, people whose air cleaners did not have filters will get air cleaners with filters. Everyone can keep the air cleaners after the study is over.
Okay, so there's an equal chance of getting an air cleaner with or without a filter.
Yes, exactly. Now let's also go over the 6 clinic visits. The 6 visits will be to the pulmonary clinic of the Johns Hopkins Asthma and Allergy Center. Each visit lasts about 3 to 4 hours and includes the same breathing tests, clinical exams, and questionnaires that we did for the screening assessment. You will also do another breathing test and complete additional questions about your health and diet.
Are there other things I will do at the clinic visits?
Yes, we will ask you to walk for 6 minutes on a flat surface to see how far you can go. If you use oxygen when you walk, you will use it for this test. You will also give blood, urine, and sputum samples. Sputum, or mucus and phlegm, will be collected by coughing and spitting into a cup. We may ask women to run a urine pregnancy test. You cannot be in this study if you are pregnant. We will also do a special chest CT scan to look for emphysema and airway disease. The scan will be done as soon as possible after using an albuterol inhaler.
I think I understand that.
Some of these clinic visits will be a bit longer because there will be extra tests. For example, an allergy skin test will be done during your first clinic visit. We will use a device with some common allergy solutions and gently press the device on your skin. There will be a slight prick or scratch of the skin.
Will this hurt?
You may develop a small itchy bump if you are allergic to anything we are testing. We have a spray to stop the itch if needed.
I see.
We will also ask you to provide an induced sputum sample 3 times during the study. For this, you will be asked to breathe in hypertonic saline, which is a salty water that will cause you to make more sputum for collection. Cognitive tests will be done during the last 2 visits. These measure your memory and information processing. These are done to learn if COPD has any impact on your brain's ability to function.
Okay, so is that it for the clinic visits?
Yes. Now I'll explain the home visits. The 5 home visits will last on average about an hour each. Each time we come, we'll install an air quality monitor in your home. We do this to measure the air quality at home.
How long will I use the monitors?
The monitor will be at your home for a week each time. Air monitors will also be put outside your home. The devices will run day and night. We will also ask you to keep a written diary of your breathing each week of air monitoring.
What else will happen at the home visits?
When we come to your home, we will ask you to complete a questionnaire about what you are doing at home and how you are feeling. You will wear a physical activity monitor on your wrist and on a belt around your waist. You will wear these both day and night during the 1-week monitoring periods. The monitor weighs less than a half pound and is about 1.5 inches in size. We will also do assessments of your heart. These assessments are optional. At 2 of the clinic visits, we will do an ultrasound of your heart called an echocardiogram.
How does an echocardiogram work?
You will lie on a table on your left side. A gel will be applied on your chest. An electrocardiogram or ECG leads will be placed on your chest. This exam does not require any injections or drugs.
I understand.
You may also do a blood vessel test using a finger monitor. At each clinic visit, we will put a small sensor on one finger of each hand. A blood pressure cuff will be inflated on one of your arms. This lets us compare the blood flow in the arm with the cuff to the other arm. When we do this test, you will need to fast or not eat before the test.
How long will I need to fast before the test?
You will need to fast for 8 to 12 hours before. We will give you snacks after fasting, and you can take your regular medications if you have any.
That makes sense.
At the end of each clinic visit, we will place a small, lightweight heart monitor on your body to wear for 24 hours. After 24 hours, you will remove the monitor at home. The monitor will be picked up by the study team at your next home visit, or you will be provided with a postage-paid box to ship the monitor back to the study team.
So you mentioned that I would get telephone calls each month. Can you tell me more about the calls?
Yes, you will receive monthly telephone calls during the study to see how you are feeling. Each call will take about 5 minutes.
And what about the sleep study?
You have the option to join an overnight sleep study at your home for up to 5 nights. If you decide to join the sleep study, you will wear a device over your nose while sleeping. This lets us record your breathing patterns. We will also record your chest movement using a small sensor that will be strapped around your chest. We will record your blood oxygen levels using a small sensor on your finger.
Is there anything else I need to know about the sleep study?
People who join the sleep study must not consume alcohol or caffeine 24 hours before the sleep study. If you join, you need to keep your usual sleep schedule the day before the study. Don't do extra naps. You will also have to avoid sleeping medications for 7 days before the test if possible, and not take sleep-related medications during the test. Wear something you are comfortable sleeping in.
Okay, I think I understand. There's screening, clinic, and home visits. Will I get paid?
You will be paid for each part of the study up to a total of $1,075 for the entire study. You will be paid $20 for the screening assessment visit, $60 for each clinic visit, $10 for the home assessment screening, $30 for completing each 1-week monitoring period, $60 for completing each echocardiogram, $25 for completing each heart assessment, $10 for each heart monitor returned, $10 for each night of the optional overnight sleep study, and up to $120 for completing clinic visits 4 and 5 and using both air purifiers. At the end of the study, you will receive up to an additional $100 if our laboratory confirms that each air cleaner ran on medium or high speed for at least 80% of the study time. You will also receive a parking coupon for each clinic visit. You may be required to provide your Social Security number to be paid for taking part in this study. You will be responsible for reporting what you are paid to the IRS for tax purposes, just like any other income.
Will it cost me anything to be in the study?
The use of the air cleaners may add to your electric bill. The money we give you for being in the study will cover the costs added to your electric bill. After the study is over, you can keep the air cleaners. But if this adds to your electricity bill, you will need to pay that yourself. After the study is over, when you replace the air filters, that cost will be your responsibility.
Okay.
We will give you a sheet about medical costs and insurance that will explain the procedures, tests, drugs, or devices that are part of this research, and that will be paid for by the study at no cost to you. And the procedures, tests, drugs, or devices that will be billed to you or your health insurer. If you have health insurance, you will be responsible for any copays or deductibles not covered by your insurance.
What else do I need to know about the study? Are there any other risks?
All research has some uncertainty or risk. Most things we do in this study are very low risk. Some are of low risk and others are of moderate risk. The questionnaires, clinical exam, skin fold assessment, urine collection, 6-minute walk test, and blood vessel tests are very low-risk activities. The blood collection and allergy skin test are low risk.
Got it.
For most people, breathing tests are low risk. You might feel breathless, want to cough, or feel dizzy. Some people may also feel chest tightness during the lung function test. Occasionally, your chest might feel sore for a few days. You may stop the procedure at any time. Very occasionally, leakage of urine or fainting can occur. The albuterol inhalers give some people the feeling of the heart racing and shakiness. These go away quickly. Rarely, inhalers cause an irregular or fast heartbeat, glaucoma, and heart problems. We will guard against these problems by checking your medical history carefully.
I see.
Breathing in the hypertonic saline may cause wheezing, coughing, chest tightness, nausea, or vomiting. If you have asthma or COPD, you will get albuterol before doing this test to minimize this risk. Your medical history and test results will help us reduce your risks. You may also experience throat irritation while breathing in the saline solution, but this generally gets better once the induction is over.
You also mentioned something about a CT scan. What are the risks of that?
The chest CT scan done is for research and is not part of your medical care. X-rays and gamma rays can damage cells, but at low doses, the body is usually able to repair these cells. The risk from radiation exposure that you will get in this research study is very small, but is more than the average person in the United States gets each year from natural sources like the sun, outer space, air, food, and soil. The radiation exposure described here is what you will get from this research study only. It does not include any exposure you may have received or will receive from other medical tests outside of this study, and radiation risk builds up with each exposure. You should think about your own history of radiation exposure from tests like X-rays or CT scans in deciding about the radiation in this study. If you have questions about the total amount of radiation you will be receiving, you should ask your doctor.
Okay.
The chest CT you are having as part of this research study will be reviewed by a qualified person, just like when you have a chest CT during routine medical care. There is a possibility that while reviewing your chest CT, we may see an abnormality that we did not expect to see in this study.
What will happen if you find something you didn't expect to see?
If we see something we did not expect on the chest CT, we may contact you by mail or by phone. A qualified person will talk to you about it. In the case of a potential serious emergency, someone may go to your home. We can give the information to your primary doctor or refer you to an appropriate doctor for further evaluation. Any additional care you seek will not be paid by this research study. Since anything we find on the CT will be part of your medical record, this could affect your current or future life or health insurance coverage.
I think I understand the risk. Is there anything else I need to know?
We ask people who join the study if we can keep their contact information to see if they want to join other studies in the future. And we may also ask later on for access to other medical records and information to help us with this study.
Okay.
We will ask if we can share your research study information with your own doctor. And if you have been part of other studies, we may ask you if we can get information from those studies to see if there is an association with those results in this study. We ask people who join the study if we can store their biospecimen samples for future research.
Okay.
I think that's about it for the study. Maybe we should summarize just to make sure it's clear.
Sure. It sounds like the main thing I have to do is complete a screening visit to see if I can be part of the study, come into the office for 6 clinic visits, and participate in 5 home visits and monthly telephone calls. I will need to run the air cleaners given to me during the study, allow you to monitor the quality of the air in and around my home, and keep a diary of my breathing and of how I am feeling every day. I will also need to decide if I want to participate in the optional sleep study.
Exactly right. If we find that you are eligible for the study, we will randomly assign you to receive an air cleaner that either has or does not have a filter installed. We will place air pollution monitors in your home to measure the air quality over 5 one-week periods. We will give you the results of the air quality test after the study is completed and will pay you up to $1,075 for being in the study. Again, our goal is to learn whether using air cleaners at home will improve breathing, lung health, and quality of life for people with COPD who do not smoke anymore.
Great. I think I got everything.
Do you have any other questions?
Not at the moment, but if I do later, who do I contact?
If you have questions about the study, please call me. Again, my name is Dr. Hansel, and my number is 410-550-2935. If you can't reach me or want to talk to someone else about questions, concerns, or complaints, you can call the IRB office at 410-955-3008. If you have an urgent medical problem related to taking part in this study, call me at 410-283-6552 anytime. This is my pager. After the tone, enter the phone number where you can be called. Press the pound key and hang up. All of these phone numbers are included in the consent form that you will take home with you today. Thank you for taking the time to talk with me today.
You're welcome.